Okay, so now we're going to move on to points on the back. So how do we find these points on the back? Well, let's first find our measure of latitude, which is another way of saying how far from the midline are these points. Okay, so first thing we're going to do is obviously find the midline. And the midline is obviously at the same position as your spinal column. And then we've got to find the medial ends of the scapula. Okay, so once you've found the medial ends of the scapula and the spinal column, we know that between the two medial ends of the scapula, it's 6 tun. Okay, and then if we do half that distance, so from the spinal column to one side, it's 3 tun. And then the medial border or the medial bladder meridian lies at 1.5 tun lateral to the midline, which means this is at the midpoint between the medial end of the scapula and the spinal column. And this meridian runs from T1 all the way down to the fourth sacral foramen. And these are points bladder 11. These are the points from bladder 11 to bladder 30. And then the lateral bladder meridian runs at the 3 tun mark, which is level with the medial border of the scapula. And this one runs from T2, so one vertebra down, all the way to the fourth sacral vertebra. And just note here that it's the sacral vertebra and not the foramen like the medial bladder. And this is points bladder 41 to bladder 54. And then let's just quickly review how to find the spinous processes. So firstly, we locate the scapula, finding its spine, its medial and lateral borders, and then we find the spinal column, and we start at the top of the head, and we feel down, and the first palpable prominence is the spinal process of C6. Okay, and then you feel one down, and this one is a bit more prominent, and that is C7. And what we do is once we felt these two, we should have the patient in a seated position, and then we ask them to tilt the head forward so that C6 and C7 become more prominent, and the space between them gets slightly bigger. And then you would, to confirm that these are the right points, you would place two fingers on the spinal cord at C6 and C7, and then ask the patient to tilt the head left and right, and C6 and C7 would be felt to rotate, whereas T1 would not be felt to rotate as it doesn't rotate with the turning of the head. Okay, and then we count, once we've discovered those, we count T1 down to T7, like from C7 we count T1 and down, and then at the angle of the scapula we know that we can count T7 there. We can count T7 at the angle of the scapula, and then if we find the iliac crest, we can find L4, which is level with the iliac crest or the iliac spine. Okay, so that's how you would find these. So if you're finding points, you would use these two measurements to speed up the process instead of having to work all the way from C7, counting all the way down to L4. This is much quicker. And then just remember this slide that we talked about where does the lung lie. I've also put a little illustration here to show you where the two meridians actually run. As you can see, this is the medial border of the scapula, here's the spinal column, and there's the midpoint between them, that's the medial bladder meridian, and then the lateral bladder meridian is at the medial border of the scapula. And then you can see, so both of these meridians run very close to the lungs, and as you remember, the lungs here on the back run, as you can see here, to T12. See, there's the spinous process of T12, they run level with it, and then at the mid-axillary line, they're going to be at T10. You can see here's T10 going down, there they'll be at T10, and then we said they were at T6, no, T8 at the mid-clavicular line. Okay, so just remember this. That's why all the points you'll see from T1 down to T12 are not perpendicular insertion. We can do perpendicular, but then it would be very shallow to avoid hitting the lungs. And then this image here is to illustrate how we needle on the back. So the top of the image is obviously their chest, the front side of the patient, and the bottom side is their back. The image on the left is T3. You can see over here it says T3. This one doesn't say, but it's T9 on the right. It's the cross section is done through T9, and this one's done through the spinous process of T3. Okay, so let's look. So you'll see that all of these points, we insert the needle at a oblique medial direction. And the reason why this is so, as you can see here on the medial bladder line, if we insert medial and obliquely, you can see we're in the safe zone. We're in mostly muscle in this area. And even if we went deeper, we would hit the spinal cord. We would not hit the lungs. And then the lateral bladder meridian, also if we're going medial in this case, and oblique medial insertion, we also are in a safe zone. Obviously, yeah, if you're going deeper, you're at a bit more risk to hit the lungs. Say your point was actually, you accidentally put the point there, you'd then be going towards the lungs. So this point, the lateral meridian, we must be a bit more careful. The medial is more safe. And then, as you can see at T9, there's a bit less muscular bulk, but we can still be safe going in a medial oblique direction. And then, yeah, the lateral bladder meridian as well. It's getting to be quite dangerous if you're going deep, so we're going a bit more shallow. And you'll see that the lateral meridian is very shallow insertion. And then this arrow shows if you had have gone perpendicular. So this is why we would say in all the slides, I say be careful of a deep perpendicular insertion or a deep oblique insertion, because if you go deep on the lateral meridian, you can hit the lungs. But as you can see, this red arrow is piercing through this. This is the rib cage, and it's going through the rib cage, and that would have pierced this patient's lungs if we had gone to that depth, which is the same as this depth. It's just that the angle has changed. And the same from here, even that more dangerous. As you can see, goes straight into the lungs at an even greater depth. And then this image here is to show if you're going in a lateral direction and why we go medially. As you can see, the same depth as going medial, going lateral would pierce the lungs, because here is the spinal, not the spinal cord, the rib cage. And then now we start with the actual points. So the first one is Daju, which is bladder 11. It's the influential point of bones. So what this means is that this point influences one of the 8 important organs or extraordinary organs. So each one of these has a special function on its specific element that it governs. So like Daju, it governs bones, which means that it has a special function of treating any disorder of the bones. And its location is on the upper back, 1.5 turn lateral to the lower border of the first thoracic vertebra. So what this means is that you're going to count down C6, C7, and then you're going to find T1 over here, and then you're going to feel the bump, and you're going to go just below it, the lower border of that spinous process, and then we're going to that line we've talked about, midway between the medial border of the scapula and the spinal column. I'm going to go midway between those two in the level of the lower border of T1. And that's where the point is found. Okay, and then this point is used for headache, pain of the neck and back, that's local functions, pain and soreness of the scapula, neck and rigidity. Oh, sorry, neck rigidity. It can also be used for cough, fever, and then I've put in red disorders of the bones because it's the influential point of the bones. And then like I was discussing with you, we do oblique insertion medially, obviously because then we're going towards the spinal cord, 0.5 to 0.7, see that's relatively shallow. And then, like I said, if you're going perpendicular or oblique lateral insertions, remember from this image, perpendicular or oblique lateral, they have the risk of puncturing the lungs. So obviously, if you're going very shallow, like less than 0.2 tun, then the risk is reduced. But still, we prefer to go medial on these points. Bladder 12, Feng Men. Its location is on the upper back. It's 1.5 turn lateral to the lower border of the second thoracic vertebra. So just like the previous one, you're just going to count one more vertebra down and 1.5 turn lateral. And you'll see the next few are all like that. Okay, so what do we use this point for? It's used for the common cold, cough, fever, and headache. And it's also used for neck rigidity and backache. And then our insertion exactly the same as the previous one. It's oblique insertion medially, 0.5 to 0.7 turn. And then remember the caution, deep perpendicular oblique lateral insertions can penetrate the lungs. Fei Shu, bladder 13. This is the first back shu point. It's the back shu point of the lungs. And this point is located on the upper back, 1.5 turn lateral to the lower border of the third thoracic vertebra. So we keep counting down. We've done T1, T2, now we're at T3. Lower border, 1.5 turn lateral, and that's the point. Okay. This one, so now because it's the lung back shu, it has special functions, and these functions are based on which shu point it is. So for this point, its special functions are that it treats disorders of the lung, the organ itself. So what you can see here is some disorders of the lungs, such as cough, asthma, chest pain, hemoptysis, coughing blood, and then afternoon fevers and night sweats. And then the insertion is still the same, and the same caution here. Julian shu, bladder 14. This is the back shu point of the pericardium. So this point is on the upper back. It's 1.5 turn lateral to the fourth thoracic vertebra. Okay, so count down all the way to 4, 1.5 turn lateral. That's the point. This one, so now it's the back shu of the pericardium. So you'll see the functions on these back shus change quite dramatically from one point to the next. As you can see, this one is now starting to treat cardiac and palpitations because it's of the pericardium, and the pericardium's functions are very similar to that of the heart in Chinese medicine. So it's treating cardiac pain, palpitations, and then it can also help with other nearby related conditions such as cough, respiratory distress, and vomiting. And then insertion exactly the same, oblique medial, 0.5 to 0.7 tun, and remember that caution here, do not go perpendicular or deep oblique lateral insertions. And then shinshu, which is the back shu point of the heart. This point again is on the back. It's now at the fifth thoracic vertebra, so we're counting down to 5, and then we're going 1 just at the lower border, 1.5 turn lateral. And then now you can see it's got more functions for the heart because it's the heart back shu. So it treats cardiac pain, palpitations, panic, mania, epilepsy, loss of memory. So the interesting thing here is that these functions of panic, mania, epilepsy, and loss of memory are related to one of the functions of the heart, which is to house the shen. Now the shen is another name for the mind slash emotions slash your personality. It's a very difficult term to have a direct translation as we don't have a easy word to use in replace of this word. But yeah, so disorders of the Shen would present with panic, mania, epilepsy, loss of memory, more like disorders of the mind. And then other functions to its local position, cough and hematemesis, and the nocturnal emissions or night sweating. Same insertion, oblique medial, 0.5 to 0.7 tun, and be careful of perpendicular or oblique lateral insertions. Du shu, bladder 16. This one is not a back shu. It's on the back, 1.5 tun lateral to T6. So a nice thing, and you can use it for all of the other ones, is as you see T6, 16. So if you think of the last digit of the number, it relates to which thoracic vertebra it is from 11 down to 16, which can help you remember this. And then the functions of this one are now not organ related because it's not a back shu, but they to the area of it, the area of where the point is, cardiac pain, respiratory distress, chills and fever, asthma, and then it's also starting to do abdominal conditions such as abdominal distension, pain, and borborygmus or hiccups. Insertion exactly the same and same caution. Okay, and then bladder 17. So this is an important point to remember. It's actually quite frequently used. It's on the back. It's lateral to T7, 1.5 tun, just like the rest. And this one, remember, we can also use the angle of the scapula over here, and we can use that as a guide to where T7 is. It's approximate, so just not exact measurements. And it's another influential point, remember, so that means it treats disorders of the blood. There are 3 main ones that we can see in Chinese medicine. We call them blood stasis, blood heat, and blood deficiency. The most common of these 3 that you'll see in practice is most likely blood stasis, which is any type of injury can cause this thing. It's anything that causes blood not to flow smoothly anymore. So one of the most common causes is injury. for instance, you fall and you dislocate your shoulder, and then that will cause damage and an injury, which will cause a blockage, and the blood will not be able to flow smoothly, and that causes blood stasis. And then the blood heat and the blood deficiency we'll learn more about in your later lectures on with Doctor Who. And then other indications, so the main indications for this point: vomiting, hiccup, belching, difficulty in swallowing, that's from its location. And then asthma, cough, spitting blood, these are actually signs of blood heat. And then afternoon fever, night sweats, and measles can be either blood heat or blood deficiency symptoms. And then one thing that's not here is the blood stasis, any type of injury, we can use this point. And then insertion exactly the same, and perpendicular or oblique insertions carry the risk of inducing pneumothorax. Okay, and then bladder 18. So this is the back shoe of the liver. And then one thing to note here, it's on the back, but it's 1.5 cm to the lower border of the ninth. So the reason why I've put ninth highlighted here is if you remember the previous point was on T7. So we've skipped T8 and we've gone straight to T9. So yes, T8, we skipped it, we did T7 and then T9. So there actually is no point on the bladder meridian at T8. So just remember that. So now you can see we can't use that nice tip. It's T9, 18, so it's +1 now. It's 1 higher than the last number. This point is good for treating conditions of the liver, such as jaundice, and then the redness of the eye and the vision and the night blindness. That's because we believe the liver in Chinese medicine governs the eyes. So these are conditions of the eyes. Also, this meridian runs to the eye. So there's two reasons why it can treat these conditions. And then mental disorders, epilepsy, pain of the hypochondriac region, that's where the liver governs, the hypochondriac region. And then backache because it's local to there, spitting of blood, and epistaxis. Insertion, medially oblique, 0.5 to 0.7 cm, and remember that caution. Okay, so that's all for this lecture. Please try to go through it yourself as well, and just read up on all the other points we've done as well, like I mentioned in the first video. And I hope to see you guys soon. Goodbye.